Bismillahirrahmanirrahim. Assalamu alaikum. Welcome into my YouTube channel Insight. We are discussing the unseen flaws in our healthcare system. Today is the third episode of our vlog series on this topic. What if I told you that the healthcare system you trust might not be as safe, transparent, or evidence based as you think? Medical errors are now a leading cause of death, yet many of these are preventable. But why are not they being fixed? As a doctor, I always believed that medicine is driven by science and patient care. But after reading Dr. Marty Makary's Blind Spots, I discovered unseen truths that every doctor and every patient needs to know. In this vlog, I shall reveal eye-opening facts about healthcare system that often go unnoticed. Facts that impact both doctors and patients. Let's dive into the unseen side of medicine. Part 3, the unnoticed facts. In this book, Dr. Marty Makary reveals that over 50% of surgeries are unnecessary in United States. Studies suggest that more than half of all surgeries performed in the United States may not be medically necessary. Second, medical errors are the third leading cause of death. He says medical errors, including unnecessary treatments and surgeries, are the third leading cause of death in the United States after heart disease and cancer. Third, $1 trillion in waste. The United States healthcare system wastes an estimated $1 trillion each year due to unnecessary treatments, tests, and administrative inefficiencies. Fourth point, doctors perform procedures they would avoid for themselves. He says that in the United States, many doctors admit that they would not undergo certain surgeries or treatments that they routinely recommend to their patients. Fifth, hospital rankings are misleading. Many hospital ranking systems in the United States are based on the number of procedures performed rather than the quality of outcomes, incentivizing hospitals to do more, not better. Sixth, 40% of knee replacements are unnecessary. He says a significant portion of knee replacement surgeries in United States is unnecessary. and could be avoided with less invasive treatment options. Number 7, C-sections are overperformed. He says in the United States, about 1 in 3 babies is delivered via C-section, often without a medical necessity, increasing risks for both mother and child. Number 8, overuse of antibiotics. Antibiotics are frequently prescribed for viral infections, which they do not treat, contributing to antibiotic resistance and harming patients' microbiomes. And this he is saying about healthcare system in United States. Number 9, lack of transparency in healthcare pricing. He says most patients have no idea what a procedure bill will cost until after it is performed, contributing to skyrocketing healthcare expenses. 10th, end of life overtreatment. According to Dr. Makary, a significant portion of healthcare spending is on aggressive treatments in the last year of life, even when these treatments offer little or no benefit to the patient. 11, misleading screening tests. According to him, many routine cancer screening tests like PSA for prostate cancer or mammograms can lead to overdiagnosis, resulting in unnecessary treatments and anxiety. Number 12, 90% of patients do not get a second opinion. According to Dr. Makary, despite the importance of second opinion in avoiding unnecessary treatments, the vast majority of patients do not seek them. Number 13, financial incentives for overtreatment. The fee for service payment model encourages doctors to perform more procedures as they are paid per treatment rather than for outcomes. He further says in point number 14, routine care for low-risk pregnancies. Many low-risk pregnancies are treated as high risk, leading to unnecessary interventions, tests, and procedures in United States healthcare system. 15 is doctors are paid more for surgery than non-surgical care. He says doctors are financially incentivized to perform surgeries because they are reimbursed more for surgical interventions than for preventive or conservative treatments. And this is true here in Pakistan as well, in other developing countries as well. Then overuse of imaging. He says diagnostic imaging tests like MRIs and CT scans are overused, leading to incidental findings that often result in unnecessary surgeries and treatments. Number 17, up to 30% of healthcare is unnecessary. In the United States, research suggests that up to 30% of all healthcare provided in the United States is unnecessary or even harmful. Number 18, overdiagnosis of thyroid cancer. The rise in thyroid cancer diagnosis is largely due to overdiagnosis of small, non-threatening tumors, leading to unnecessary surgeries and treatments. Number 19, defensive medicine. He says physicians frequently order unnecessary tests or treatments not because they are needed, but because they are afraid of being sued for malpractices in the United States. Then 20th point is lack of accountability for overtreatment. He says there is little accountability in the healthcare system in the United States for doctors who perform unnecessary treatments or surgeries. The 21st point is medical schools teach too little about costs. He says medical schools in United States rarely teach doctors about the cost of healthcare services, leaving them unaware of the financial burden their recommendations place on patients. The next point is prostate cancer overdiagnosis. According to him, the PSA test for prostate cancer often leads to overdiagnosis and unnecessary treatments such as surgery and radiation, which may cause more harm than good in United States. The 23rd point is patients are rarely informed of all options. He says many doctors do not inform patients of all treatment options, including less invasive or conservative alternatives. And 24, surgical complications rates are underreported. According to him, many hospitals in United States underreport their surgical complication rates, hiding the true risk of certain procedures from the public. And the 25th point, burnout in healthcare professionals. Dr. Makary says that the pressure to perform more procedures combined with the administrative burden contributes to high rates of burnout among healthcare providers. These facts from Blind Spot expose the widespread problem of unnecessary healthcare in the United States and other developed nations, emphasizing the need for systemic changes to prioritize patient safety, informed decision making, and value based care. Main themes and key takeaways of his book, The Blind Spots. Flawed medical guidelines. Many widely accepted medical recommendations are based on outdated or incomplete evidence. For example, the previous guideline advising patients to delay peanut introduction in infants actually contributed to the rise in peanut allergies. Second, main theme, overuse and misuse of medications. The opioid crisis originated from misleading information that downplayed addiction risks. Antibiotic overproduction has fueled the rise of drug-resistant bacteria. The third theme is that medical dogma versus scientific evidence. Once a medical practice is widely accepted, it becomes difficult to challenge even when new research disproves its effectiveness. For example, routine procedures and screenings that continue despite evidence suggesting they may do more harm than good. Fourth, bureaucracy and systemic issues. Insurance policies, hospital protocols, and medical politics often prevent the adoption of better evidence-based practices. Defensive medicine, ordering unnecessary tests to avoid lawsuits, drives up healthcare costs without improving patients' outcomes. Number fifth, empowering patients and reforming healthcare. Patients should be encouraged to question medical advice and seek second opinions. The medical community must embrace transparency. humility, and adaptability to improve healthcare delivery. So, in conclusion of this book, what I find Dr. Makary argues for a shift in the medical field, one that prioritizes critical thinking, embraces new evidence, and eliminates harmful or unnecessary interventions. His book is a wake up call for both medical professionals and patients to challenge outdated practices and advocate for a more effective patient centered healthcare system. So I end here. In the next episode, we shall discuss the issues relevant to developing countries like Pakistan. That how we can see our healthcare system in the light of points highlighted by Dr. Makary in his book Blind Spots. So see you in the next episode on discussing that how these issues are relevant to developing countries like Pakistan. Till then, take care. Khuda Hafiz.